What if I told you your arches are collapsing because your hips aren't doing their job? Most people don't know that having weak hip muscles is actually one of the most common reasons that people develop flat feet. I'm Matt Sigwell, a doctor of physical therapy, and in this video, I'm going to explain exactly why having weak hip muscles lead to your arches collapsing. So we've all heard that having an issue in one part of your body can lead to having problems in a different part of your body, right? This actually could not be more true when talking about the lower body. Specifically, your hip joint has a major influence on the position of your knee joint as well as your foot and ankle joints. Now, this also works vice versa, so moving from the ground up, so from the foot and ankle all the way to the knee and all the way back up to the hip. Both directions have an influence on the alignment of each joint and the position of each joint. So if you have a deficit in one area, whether that's your hip, your knee, or your ankle, those will affect each joint as you move up or down the leg. So to explain why an issue with your hip can lead to a problem all the way down to your foot, we have to talk about the function of the specific hip muscles that will cause this, right? So specifically, we're talking about your glute medius and some of your hip external rotators, right? So with your glute medius, just based on where it's attached from the external or the outer portion of your hip bone, and then attaching all the way down to your greater trochanter or the outside of your femur bone, because of where it attaches, as that muscle contracts, what the main functions of that glute medius muscle, what it does is it abducts your hip. So essentially, if you're standing, it helps you bring your leg to the side, and it also helps with some rotation of the hip, like for example, like external rotation. So almost like you're bringing your knee out away from your body. So those are the two main things that we're talking about here for your glute medius. It brings the leg out to the side and it rotates the femur out to the side. Now, when that muscle becomes weak and it's unable to perform those functions as good as it should, what you'll see is people, as they do squats, as they go up and down stairs, or even with walking and running, when that muscle is weak, it'll cause what people often see as knocked knees. So the knees will collapse inward and together. So that muscle is unable to counteract that knocked knee position, right? If that muscle is healthy, your knees don't touch and they stay parallel with each other, and they have a nice natural neutral space. But when they're weak, they'll start to come together, right? So that's like knock knee position, which is prevented by having an adequate strength with your glute medius muscle. So the glute medius has an influence at the hip joint going down to the knee joint, right? So initially, in terms of knock knees, people would typically think, oh, maybe it's a muscle like your quad, your hamstring, something specifically at the knee joint. But with your quad and hamstring, primarily, they just flex and extend, so they just straighten or bend your knee. In terms of the side-to-side movement or stability, your hip muscles, so like your glute medius, how we talked about, that is the main one that's stabilizing the knee in the like medial lateral or side-to-side plane, right? So your hip, your glute medius, is going to prevent the knees from going in. Now, let's say that glute medius is weak and you're getting knock knees. That position of having your knees touching, going into that knock knee position, in turn has an effect on your tibia bone, which is attached to your foot and ankle joints, right? So because that tibia is now going together because it's in that knock knee position, as it attaches to your foot and ankle, now, as you naturally have that arch in your feet, right? That on the inside of your feet, you have that natural arch. If that tibia was to go into that knock knee position, what you'll see is the arches will flatten that side where your big toe on each foot is, starts to get closer to the ground because the tibia bone is forcing its way towards like the center line of your body, which in turn flattens out the arch even more. In physical therapy, whenever we're assessing and evaluating a patient who comes in with complaints of plantar fasciitis or just collapsed arch, what we'll look at is, at first, we'll check out the feet, check out the toes, check out the ankle joints, right? See what those foot muscles, check their strength, check the range of motion of those joints. However, we won't just isolate the foot and ankle. We also will look above. So looking proximally is what we call it. We'll look at the joints that are above the ankle joint and the foot and toes. So we'll look at the knee joint, see how those musculatures in terms of their strength, if there's any deficits there, as well as looking at the position. And we'll look above the knee joint, looking at the hip joint, right? Because then typically, if you have collapsed arches, that work its way back up, how we talked about. So collapsed arches will also lead to having knock knees, and in turn having your hips, those glute med muscles being weaker and even being adducted, or the femurs will go in together. So for people with flat feet or collapsed arches, what are you supposed to do in terms of physical therapy and rehab? Now, if you've been to physical therapy, you've probably worked on dome training, worked on some towel curls, working on a lot of the strengthening that you need for those smaller intrinsic muscles of your foot and ankle joints. Those are definitely great in terms of addressing some of the isolated muscles that are responsible for preserving and maintaining that natural arch of your foot. On top of that, usually with that collapsed arch, there's multiple factors, multiple deficits that are leading to that poor foot flat posture. So on top of those small exercises for the foot and ankle muscles, you also want to add in targeting these hip muscles that we talked about. So like your glute medius, for example. So a lot of times you'll see some like side clam planks, regular planks, some hip abduction and with a band or some kind of loaded resistance. So making sure that you add exercises that address the muscles of the hip as well as the foot and ankle, because then that's going to really address the full chain, whether that's from the hip to the knee to the foot and ankle. So those are going to be the main issues in terms of being a well-rounded, fully encompassing rehab program. You don't want to just isolate and focus on just these small muscles of the foot and ankle, because usually there's more than one cause for this flat foot. So if you work from the foot to the knee all the way to the hip, typically you're going to get good results and have less pain when it comes to having flat feet. Thanks for watching. If you found that video helpful, please subscribe to the channel, and I'll see you in the next video.